everybody, and welcome back to an invisible and invisible illness awareness project. I've been focusing on mast cell disorders for the past few weeks, and I mentioned that I had a list of everything that was going to be done during this hospital stay, and that there was a questionnaire about mast cell mediators to see how likely it is that you have a mast cell disorder, and that a lot of weight was placed on this questionnaire. So I had a few people asking about it. They wanted to see both of these documents. These are actually not things that they just give to every patient that they see. I do have a copy of them both, but it's really just because of sort of a special situation that I'm in that I even got them at all. But I would like to share as much as I can with you guys. So I decided to go ahead and translate these documents. I've spent the past few days really focused on this questionnaire. First of all, I had to type it up and then translate it, and I've done some translation work in the past, so I just decided to calculate this up out of curiosity, and had this been a paid project, I could have earned 300 euros for translating the document alone. I have no idea how much you would get paid for typing something up in the first place, but that is a significant chunk of change. So I want to make a deal with you guys. I would be willing to upload these documents so that you can have a written copy for yourself, but I'd like to ask for something from you guys in return. I just recently signed up for this site called Patron, which is for supporting artists. In this case, you would be supporting me sharing these videos, sharing these experiences, and sharing this information with you guys. So what you do is you sign up and you can pledge however much you want. You can pledge as little as $1. It can be per month or per video. You can do more. You can end it whenever you want, but just $1 a month to help support me making these videos happen, and just to get a little bit of compensation for the time that I'm putting into this. I would really appreciate it. So what I'm going to do is I am going to share part of the questionnaire with you guys, but if you would like to have access to the whole thing in writing, then please go sign up on Patreon and become a patron, and it will be there waiting for you. Okay, so here we go. To determine whether your symptoms are due to the inappropriate release of mast cell mediators, we ask you to fill out this questionnaire. Please list all symptoms, even if they appear to you to be only marginally distressing, infrequent, or unrelated to the main complaints. And then you have, this thing was originally 6 pages long of symptoms, and then you have columns with yes or no. And if you choose yes, then you get a certain number of points, but there actually aren't points allotted to every single symptom. Not sure why, but maybe just symptoms that could really be caused by anything, but they're still relevant to mast cell disorders, because if you have a mast cell disorder, then that could be what's causing that symptom. So, okay, so I have stomach pains. Yes or no? And then you have the stomach pain is burning, you get 1 point. Cramping, 1 point, or accompanied by diarrhea, 1 point. The history of symptoms is or was episodic, 1 point. The symptom-free intervals have become shorter and shorter over time, 1 point. Nausea occurs episodically, 1 point. That quickly responds to 5-HT3 antagonists and or H1 antihistamine therapy, 1 point. So you get 1 point if you have nausea, and another point if it responds to therapy. I have episodic attacks of burning or stitch in my chest, including feeling life-threatening. My doctor couldn't find anything unusual in EKGs, 1 point. Pain that does not respond to painkillers and or sensitivity, i.e. tingling, numbness, and similar, occur episodically or continuously. 1 point. I have recurring or permanent bladder and or pelvis pain accompanied by excruciating urgency to urinate or blood in the urine. Bacteria could not be found in urine. 1 point. The esophageal-gastroduodenoscopy or the corresponding biopsies found no pathological findings, 0 points. Slight signs of inflammation, 1 point. Helicobacter pylori and NSAID negative erosions and or ulcers, 3 points. Mast cell nests and or spindle-shaped mast cells and or CD25 positive mast cells, 10 points. Or focal and or disseminated dense infiltrates of morphologically unremarkable mast cells, 5 points. For the colonoscopy, goes through the exact same thing, except instead of Helicobacter pylori and NSAIDs, it's melanosis coli in the absence of anthraquinone abusus. Mast cell mediators. The serum tryptase concentrate was normal, 0, or was marginally increased, 3 points, or with more than twice the normal value, 10 points. The level of N-methylhistamine in urine was normal, 0, was marginally increased, 1 point, or was up to 10 times the normal value, 10 points. The concentration of chromogranin A in serum was normal, 0, was slightly elevated after excluding other causes, 3 points. I've experienced the following skin changes. Urticaria, for some reason there's no points there. Swelling, especially around the face. Lips, cheeks, eyelids, no points. Red-brown flecks and or knots on the skin, 2 points. Yeah, so that's basically a little preview of the questionnaire. The diagnostic criteria does weigh more heavily, which is part of the sections where you don't necessarily have to fill it out yourself because they're assuming that you're coming there to have these tests done. But they do really care to know what's going on with you subjectively, and I think this information is also very important because if a lot of these things keep showing up in different patients and they have a record of it, then they can maybe add that to the list of official symptoms down the line. Then at the end for the evaluation, it says the differential diagnoses listed in the annex should be excluded. In order to evaluate, you add up the numbers next to the boxes that you checked. If you have a sum of more than 14 points, then the diagnosis is considered clinically assured. When I initially filled this out, I had 32 plus. There was a couple where I wasn't sure if it was like 5 or 10 points because I couldn't remember the exact results. But at least 32 points. And then after all of the tests they had done, of course, there would be another few to add on there. So it's definitely clear that I fulfill the criteria. If you'd like to have a look at this in detail, see the whole questionnaire, fill it out for yourself, then sign up for Patron, become a patron, and you will find everything you need there. And I will see you next week.